Welcome to episode 2 of Medically Assisted Recovery. I'm James Eade, and I am someone who has bent the knee to the tyranny of addiction. I know what it's like, and I know what recovery is like as well. And I've been in a lot of different programs by choice to check them out, to see what they offer. And I have found very good things and some things that put me off a little bit. Maybe your experience is a little bit like that. But we know that one size of recovery does not fit all, and there are alternatives out there. And I'm interested in broadening the awareness of some of the alternative technologies and treatments that are out there. And medically assisted recovery is not something that I have done. So I've brought an expert on who can tell us more about it. And I call this expert Dr. Gino. Hello, and welcome to episode 2.
Hello, James. Thanks for having me. I'm so excited to be here, and I'm glad
Oh, thank
to
you for saying that.
participate in broadening the information because it's really about information that people don't have that keeps them from exploring what is possible.
Exactly. And what I found is that when I went to when I was in the Stanford emergency room, and what I was told there was I had one of two options: either a counselor, a therapist that specializes in the field, or that I could go to a traditional 12-step program.
Mhm.
I wasn't given any other options, and I didn't know about any other options. And it wasn't until later in my recovery that I found other programs that, one was Buddhist based, which was very attractive. Another was yoga based, and it was very attractive. So there's a lot of things. And I found that, if you can't find if you don't seek. And so you have to look out and to find. So you have to kind of put yourself out there, give some effort into your own personal recovery. And this is an effort of will sometimes, where you're not inclined to do it. You don't have enough hope that it'll work. And the first thing that you try doesn't seem to be for you, so you give up hope.
Mhm.
And so what the two of us are trying to do is broaden the awareness of what I call medically assisted recovery. I think in the medical community you call it medically assisted treatment, but whatever the terms that we use, there's a medical component to it. And from what we've shared in the past, your approach is a little bit more than the traditional medical approach that you would find in a hospital setting, as I did, for example, or um, at large in the medical community, because they may not know as much about addiction, the detox effects, and that sort of thing. So I'm really curious about what is it that you do that's different.
Well, I want to say thank you for that introduction and a couple of the mantras that I've definitely been living with. One of them is, you don't know what you don't know.
Hmm.
And I think that that's really an important part of understanding that when we are existing in our limited resources, meaning what we've heard already and not open to expansion, we can prevent ourselves from a growth opportunity. And that's where my logo that says unlock your brain, that's one of the unlocks,
That's
is
up in
recognizing
the
that we
corner, right? Yeah.
we
And
have the ability to really
your
expand what we believe is possible.
yes.
And so one of the things that's also true, since you mentioned Stanford, Stanford is a institution that is an academic institution. They do a lot of great things. But one of the things that I see from a lot of academic institutions is they focus on protocols, and a lot of times insurances, for example, focus on FDA approval. And I think that's one of the first limitations that I see within traditional addiction medicine kind of programs, detoxes, is that insurers, patients, doctors, everyone's looking at what the FDA has approved. And if you're looking at what the FDA is approving, you're actually missing out more than 100% more of opportunities for medications that might be helpful. I'll give you a really easy example. There is no FDA medications that are approved for stimulant use disorder. Yet, if you go talk to people that are in the trenches, there are medications to help people to stabilize with stimulant use disorder. So if you're going to be focused on the FDA, you're going to be missing out on any opportunities that are potentially valuable to help you stabilize and expand. So
Dr. Gino, I don't mean to interrupt, but you use the term stimulant use disorder. And so would you say, instead of calling myself an alcoholic, I would say that I would have alcohol use disorder?
that's a wonderful and super important idea, is that sometimes when we add the icks to our life, right? When I call myself an alcoholic or even a diabetic, right? We start owning those kind of descriptions, and then sometimes we manifest what we own, right? And instead of recognizing that I have been treating my pain using alcohol, or I've been treating my pain using stimulants, or I've been treating, living with diabetes, right? So that it's different. You don't necessarily want to own that, and it's part of the power of language. And the human first language movement is absolutely doing what you're talking about, is, instead of calling someone an alcoholic or declaring that you're an alcoholic in a 12-step meeting, right? Saying that, I have used alcohol to help me cope. I've used alcohol to help me to escape. I've used alcohol, because the truth is that we have a reason. We all have a reason, because as a survival behavior, we have a reason why we do that thing.
Yes. And, I participated in adult children of alcoholics, and it was really useful for me. It's another program that I didn't know existed, because it got me in touch with the experiences that I had repressed or suppressed, and that were causing into my adulthood issues that I self-medicated over. When I was able to get in touch with those things and to deal with them, not just intellectually, but emotionally as well, and with a support system around me, a community of people that were doing the same types of things, same type of work, I found that all of a sudden the anxiety that I experienced throughout adulthood, starting with my childhood, I used to have nightmares every night. I tried to stay awake as a child, but I always fell asleep. And so that anxiety, what was the source of that? And without judgment, without blaming, just coming to grips with it was a key part of my continued recovery. And being able to get a sense of that I was not to blame. I was just coping with things that, as you mentioned, the pain, the suffering, that you're taught not to talk about it. And we had this unwritten rule that it wasn't a problem unless you talked about it, and if you talked about it, you were the problem. So we were supported in not talking about it and not addressing it. And so I went, at least for me, I went through high school, college, and career without really dealing with it, without even knowing it was possible to deal with it. And so I think that I just wanted to emphasize with my own personal history how important that is.
Yeah.
And so I'm wondering, I think it's wonderful.
Thank you for sharing your story. And adding some really important details about the emotions and the behaviors, right? Because not all of those behaviors are things that people would throw stones at, right? Not falling asleep, right? People wouldn't throw stones at that, but they're going to throw stones at you for using your substance, right? So it's interesting how we judge different coping behaviors, survival behaviors in different ways, right? When you use a coping behavior like success,
like workaholic,
you get a lot, right? Yeah. But when you use a coping behavior like, substances, you become, someone who is immoral. So it's very interesting, because all of these are coping behaviors. All of these are survival behaviors. And we're really giving, different, values to the versions of survival that you've learned. But we all use the skills that we have at any moment. And when we learn how to use new skills, and that's really what medication-assisted recovery allows, because when you get stabilized on medications, you can then start to incorporate and learn and receive new skills. If you don't have the resources to be able to avoid the noise that happens as you're going through a withdrawal, you're not able to then receive other information because your brain is saying, hey, you're in an alert mode, right? The alarm's going off. I don't have the ability to concentrate on what you're trying to teach me right now.
Yes.
And that's really what medication assisted recovery allows, right? It allows you to turn off the noise so then you can receive the other tools.
Wonderful. Wonderful. So, tell me, I'm a patient and I'm going to tell people how to get in touch with you, but I'm approaching you and I'm saying, I have this substance abuse disorder or some substance usage disorder, sorry, and I want help. And what can you offer me? And I'm a little skeptical when I walk into your office.
So I'm going to back you up a little bit because you mentioned something that is so important during your own story, and you use the word self-medicate. And the reason why I want to point that out is because when I'm offering a medication, a lot of times people say, well, I don't want to be on a medication. I say, well, you're already using a medication. Yes. Right? So we're actually just going to be transitioning you from one medication to a medication that I hope you feel is safer. And, especially now in this era where fentanyl could be in almost all of the substances that you can find on the street, it's so much safer to receive this medicine from a pharmacy that we know the source of the medicine compared to your street pharmacist. Right. And so what I'm trying to do is move you into a position of safety. The next thing I think is so important, and this is where I think our psychiatry friends have gotten it wrong, by separating the mental health from the substance use. So a lot of times they use the phrase dual diagnosis. Yes. And it turns out that dual diagnosis has always been part of the substance use story. And the secondary diagnosis, the primary mental health diagnosis, whether it be depression, whether it be anxiety, whether it be, one of the bundles of anxiety, because trauma and shame and all the things that kind of get pushed into that anxiety bucket can absolutely be the reason why people are surviving with substances. And so one of the things that's true is I open up my medication bucket. It can't be just medications to stabilize your substance use. It has to include medications that help stabilize your mental health. And so I will often be using medications at the same time. And I think that it goes back to that first idea, is that you're already using medication. I'm just going to try to introduce you to medications that might be safer and help you down the line make some additional choices to incorporate tools that will help you. And if you're successful, you may be able to get off of these other medications. Right. But the truth about medication-assisted recovery is it's there for as long as you need it. And some people just find that taking the medications have helped them and they don't want to get off them. It's like, you know what? I've built my career and I have no problem taking this medicine, and I can receive this medicine. I don't have to go to a methadone clinic, because the methadone clinic does create a little bit of challenge, right? You have to get to the methadone clinic. It's usually a daily dosing. And so there are what I'm going to call better options, but we have to get you to those better options. And sometimes methadone is the best option for you. And then you have to live by those rules. But the good news is that there's a lot of medications that we can offer that are in the scope of all of the doctors. We just have to be willing and brave enough to look outside of our own limiting beliefs that addiction is hard. One of the things that's true is that life is hard and addiction is part of life. And a lot more of our clients are using substances to self-treat than we want to acknowledge. And so the truth is that a lot of the patients that are seen in primary care are having mental health issues. And so by incorporating both information about mental health and stabilization of substances, that's the magic that I bring to the medication-assisted recovery. If you're not doing both simultaneously, then you're not really going to help the client move forward because they're already self-treating. We just need to let them know that the medication that they're using is maybe not safe and we can have better options.
That's a wonderful, wonderful description of what it is that you do and why you do it. Because as a child, I had defense mechanisms, but they turned into survival instincts. Mm-hmm. And it was coupled with my own ego, which would say that I knew better. I didn't need anyone's help, and I could do it. I can do it myself. all of those things, all those barriers to health had to be let go of. And so this was not easy. And the letting go of survival instincts and defense mechanisms that no longer serve is not an overnight sensation. It doesn't take place, in a short period of time. It takes work, it takes perseverance. But under the supervision of a medical professional, getting the safety built in, this is the thing that so many of us who have suffered from these types of disorders or usage, issues, we often don't feel safe. And I never put that two and two together there. I was saying, why am I anxious? I thought I had anxiety. But the root of the anxiety was I did not feel safe. Yeah. And so feeling that going into a medically assisted where someone is measuring the dosage, then the source of the dosage, you're not going to overdose. You're not going to have a severe, and if you do have some sort of reaction, the medically trained professional is there to help you. You build in that safety factor. And for me, that eases the anxiety and the resistance that I would have to being helped.
I really appreciate your testimony. And I want to just share a little bit of irony, right? Is that our mind often moves us into safety. And sometimes escaping using substances, escaping using food, escaping using other kind of addictive behavior makes us feel safe, right? And that's the irony, is that when you're removing the substance, when you're removing the behavior that makes us feel safe, then we feel a little bit more vulnerable. And that's why incorporating help is so valuable, right? And that help comes in community, that help can come with medication, that help can come with other kind of habits that you've built in, like meditation and yoga and breath work. And so we don't have to always think that medication is the answer, because it's actually not the answer. It's only a way to help stabilize so that you can find your answer.
So well said. Thank you so much for that. Because, for me, the deep breathing that you mentioned, and that was, I was taught that in yoga. And it was funny because, I kind of resisted doing yoga because I thought it was about flexibility and women and Lululemon. And it was like, not something that I was, kind of drawn towards, or even thought that it would help me with my recovery. But when I started it, one of the things that I was fascinated by was the concentrating on my breath. It was funny for me to learn, surprising for me to learn, that the mind can calm the body and the body can calm the mind. And the breathing was an important aspect of it. And to be able to take a deep breath was such a calming experience. And I thought I knew the definition of calm, but for me, it was a lower state of anxiety. I thought that's what calm was. I wasn't panicking. I wasn't freaking out. I was relatively calm. But I've learned that there is a deeper state of calmness that you can achieve. And it's akin to serenity, where you feel at peace. And these are the promises that we have in recovery that people just don't think it could happen to them. And I was one of those people. And I thought when it happened, I could not believe that it was, all of my preconceived notions, all of my contempt prior to investigation, yoga, all deep breathing. Oh, great. But just being able to move my energy around my body and to be in touch with my body in a way that I had never been before. These types of things, these types of experiences were so powerful that I could not deny them. As stubborn as I was unable to deny the effect that they had on me.
Yeah. Thank you for introducing the concept of somatic wisdom, right? The internal wisdom that comes when you're connecting your breath and mindfulness to the body.
Yes. Yeah, that's a whole nother show though. So I've walked into your office. I've walked into your office and I've expressed a little bit of skepticism, and I'm saying, what can you do for me? Let's pick up there next time we talk, and we'll end for today. But thank you so much. And I wanted to do one thing before we end, and this is how you can get in touch with Dr. Gino. Texting Dr. Gino at this number, scrolling across the bottom of your screen right now, is the best way to get in touch with him. And he'll get back to you, and reach out. You're not going to get better staying at home. Isolation was part of my disease. It was part of my experience. And isolation turned out to be, I was ill-suited for isolation. And I self-medicated to deal with it. So reaching out, getting around other people, getting help is not a bad thing. It's not a sign of weakness. It's a sign of strength, that you want to live a life that's not only worth living, but it's a life that is joyful. You can experience joy, happiness. These things are possible. It's been to much of my surprise, I have experienced them myself. So thank you again, Dr. Gino. And hopefully the viewers will reach out to you. Some of them will, and I hope that's going to work out for you and them. So
thank you so much for expanding the information so that people can receive it and then decide what to do with it.
Okay, thank you. That's the end of the program for today. Stay tuned.